Okay, you all. So I have been working in a hospital for over 2 years. I started off as an LPN working in nursing homes for 8 years, then became an RN and started to work in a hospital, right? There's definitely a transition in going from long term care to hospitals. And I think I have a video talking about it, but I want to give you all like some tips, some things to think about when you're going through that transition and just kind of what it's like, okay? So the first thing is there may be skills that you just don't have. For me, it was the venipunctures, drawing blood, doing IVs. Of course, I knew the concept of doing an IV, put the tourniquet on, feel for it, make sure it's bouncy and plump. Okay, do this, go in with the bevel up, make sure it's, not a valve, blah, 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 blah. I knew all of those I knew the actual technique behind it. But there's also a skill that comes with it that I just did. I wasn't getting any IVs for like the first few months, right? So I was looking and I was like, okay, in the morning, the lab techs are coming in. They're doing these 4 o'clock blood draws and they're just getting it. They're zooming through the rooms, getting it. And it's the same concept. You want to hit a vein. So I would just go around. It was one particular lab tech. And I would go around with her and see what she was doing. And my thing, it was a tourniquet, y'all. I did not put my tourniquet on. I had the technique all the way down of how to start an IV. It was a tourniquet. Something as simple as not putting my tourniquet on tight enough was causing me to have to poke somebody right? You're only supposed to do it 2 times, but 2 times. And needing to go, I always ask for help with my IVs. Putting my patients in uncomfortable positions, not being able to get my own IVs, feeling insecure, things like that. You all, that we're gonna have certain skills that we just need to work on, and that's okay. We're going from being in long-term care to being in a hospital, more acute setting. So don't let your ego stop you from getting the help that you need. I could have been like, I'm a nurse, why would I go to the lab tech to ask for help? But evidently they have a skill that I don't have. So let me watch them. Let them show me. And they were, even to this day, yesterday I was at work and I was like, let me see how you put that tourniquet on there, girl. And she's like, oh, hold on, I'll show you again. Hold on, let me show you. And she showed me. I was like, okay. The next time I did my blood draw, I'll start working on doing her technique. Got both my blood draw. I got 2 out of 3 IVs. One IV, I pretty much knew I wasn't going to be able to get it because the patient was a little heavier. And y'all know when a patient's a bit heavier, it's harder to get IVs on them because it's just so much adipose tissue. So it's a little harder. But she had to get an ultrasound IV. But anyhow, I was able to get everything I needed to do for my patients because I'm looking at how their technique. So I say all that to say, humble yourself. Look around, get the help that you need. If there's someone on your floor who's always able to get an IV, watch them. What do they do? And that's what I would do too. I would just watch people, how they're, even just a little small, like how their hand might move. Just look at them. Pay attention. Be observant. This is one of the skills that we as nurses have to always hone in on, is our skill of observation. So just know that there's going to be skills that you don't have that you need to sharpen up. And this is why a lot of nurses say, I don't want to go in the nursing home, or I might not want to do home health, because you want to keep those clinical skills. And it's okay if you don't have them, but it's not okay if you're not willing to do the work to build on those skills, okay? To ask for help or to seek help in ways that are maybe unconventional. So that's just one example that I had. There may be terminology you don't know. I worked on a surgical unit, so it was different surgeries I had to look up, because your patients will ask you questions. How long will it take? Do you see a lot of patients with this? How is the recovery? Now, of course, these are questions that the physician should be answering, but some of these things you might be able to answer. And I'll tell them, I have seen a few patients and typically it's like this or like that, but your doctor should be able to give you more information. Of course, they've seen way more surgeries than I have, but just from what I have seen, this is something that happens. So you have some type of reference to go off of, but of course, always let them know, child, you got a physician for a reason. So refer to your physician. But from what I've seen and from what I know, which I say is very limited, I don't know a whole lot about it. From what I've seen, this is that. And sometimes you just say, I'm really not sure. We would have to just talk to the physician. They'll be here in the morning, that type of thing. So know that you are not going to know everything, and that's perfectly fine. It does not matter how long you've been a nurse, how long you've been in healthcare. There are hundreds of different specialties in nursing. There's so many different work settings. There's so many different nuances to working in healthcare. So to really think in your mind that you know everything and that you've been in the game for 10, 15, 20 years, 5 years, whatever, and you think you're supposed to just know everything, and if you don't know it, you're less of a nurse, that's silly. It's silly. There's a reason why physicians, they will consult somebody. You'll ask a general physician, you'll say, hey, I need my patients having these issues. Oh, psych consult. They understand that's not my specialty. I don't get paid to know that. Let me contact someone else, get them on board, and they can handle that. And I'll handle what I need to handle. But I think with nurses, we're such generalists. You know, we know a little bit about everything. So sometimes we feel like we have to know everything, right? We have to know everything, but that's not necessarily the case. We're still learners. We're lifelong learners. Isn't that what they tell us in school? We're lifelong learners. So keep that curiosity within your mind. Keep that humble energy within your mind and ask for help. Ask for help. Ask for help. Ask for help. Something you don't know how to do, ask for help. And I'll tell you, my husband, he's like, there's nothing wrong with asking for help. Now, you shouldn't be asking for the same exact thing over and over again. Somebody shouldn't have to tell you every time how to do something. You know, like how to look for this form or how to find this. You shouldn't have to keep going to somebody. You should, okay, come on now. By that second, third time, you should know. Now, of course, like I said, with certain things like skills like IVs and stuff like that, you're just not going to be able to get it sometimes. But how to find the blood, like the blood information, what do you call it when you have to do like a blood transfusion? How to find that in Epic, that's something that you write it down, honey. Write it down so that next time this come up, you have your reference, okay? Even put it in your phone, put it under a Google Doc, put it under a draft in your email, and you can go to it. Put it in a draft in your work email. You can look it up on the computer real quick, find what you need to find. So you're not constantly going to people for the same information, because that's when people get tired of you, okay? Keep that in mind. Well, let's see. Something else. I say ask for help because at the end of the day, you don't want your ego to be the thing that creates a bad outcome for your patients. We want to make sure our patients are having good outcomes. They're having a good experience because they're already in a hospital. If you're in a hospital, you're sick. You're sick. So we want to make sure these people are in the best position as possible. So you don't want to let your ego stop you from being able to give good care to your patients. It just is what it is. And even if maybe another nurse or the charge nurse or the doctor or someone has an attitude with you, they're mad, they're huffing and puffing, it doesn't matter. Because it's better for you to ask for that help, ask for clarification, blah, 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 blah. It's better for you to do that than for them to be having an adverse effect because of something you did or did not do. Keep that in mind. The stakes are higher when you're in that hospital setting because things are more acute. Things are more acute. Also, scan your meds. I know that when we work in the nursing homes and things like that, sometimes it's just, we're not scanning meds. We don't have a barcode to scan a med. You'll click on the MAR, okay, but it's not so much in real time as it is in the hospital. But things are happening in real time. Things are changing in real time. A doctor will put in an order and then turn around and change the order and say you gave the pill or you gave it and you didn't scan it. Now it says that you're supposed to get half a tab and you gave them the whole tab. What can you do? Like, really, what can you do? I even had at one time, one nurse, she was looking, I forgot what med it was. It was something that wasn't on the unit, and then the pharmacy couldn't find it. She had to go to another floor and look for it. She did all of this over-the-top stuff. Finally got it. Went into the room, ready to scan it. The doctor DC'd it. I'm like, what? I know she was upset. She said it took her like 30 minutes just to get everything together. And then she finally got it, and the doctor took it off. Took off the order, discontinued it. Had she hung it, started to give it to the patient, and then scanned it, you can't take it back. You already, especially if it's an IV medication, you already started it. You can't take that back. And sometimes patients are getting half a dose, double dose. And you want to just make sure that you're scanning this information in real time. And that's what we're supposed to do anyways. But I do get it when you're going from the long-term care to the hospital setting. Sometimes that habit is not embedded in you, especially if you feel like you have to constantly rush to get work done. Sometimes you just throw the pill at the patient or whatever, and it's just like, no, you need to scan them in, do your whole thing, name and date of birth, patient identifiers, and then give it. That little moment of time that you gave yourself can save you. Trust me, it will save you. Let's see, something else. I know when you work long-term care, nursing homes, a lot of your patients are going to be having dementia, right? Or they might not be as alert. And so having to explain certain things to them you might not have to always do that. So a skill that you may need to learn or start to work on is your communication, having clear communication, going through the notes that the doctor put in and being able to let the patient, like the patient might say, so when are they going to take this chest tube out? Or when are they going to do this? And when are they going to do that? When are they going to change my diet? You might not know, but you have to go in there, look through that chart and see, okay, the doctor did say that they want to see how you do on clear liquids for a while, for maybe a day or two, and then they might advance you to low fiber, something like that. These are skills that you have to learn as far as patients are going to actually want to know what's going on. Now, I'm not saying in nursing homes you don't tell them what's going on, you just gaslight them. No, I'm not saying that, but they more than likely have had this care for years. They've been taking this medication for years. But sometimes you got a patient, they just got diagnosed with diabetes. So there's a lot of more patient education that's there. There is a whole lot. Because some people think, oh, as long as I take my insulin, I can still drink and eat this. I mean, yeah, you could, but you probably don't want to, because it's still going to create issues with your vascular system. Still going to create issues with your kidneys that can lead to you being on dialysis for the rest of your life. And maybe needed a kidney transplant. And hopefully the kidney transplant takes. That your body doesn't reject it. Hopefully you even get a chance to get it. Yeah. Hopefully you don't lose a limb. But these patients, they're not thinking about that. They just got diagnosed with something. The doctor told them they're going to have to take insulin. Okay. They might not see the severity of it. So you as a nurse, again, you are there to educate the patient, give them more information. And this is just another skill that you would have to learn and grow. And for me, I found that observing others. What are other nurses saying? How are they talking to patients? How are they doing their assessments? You know, when you have new admissions and maybe the charge nurse is in there and they're asking specific questions, they're explaining things in a specific way. Especially if you have a charge nurse that's on their stuff and they're helping you out. They kind of have like a script that they go by with all the patients and how they say certain things. And you can just mimic that chart. Like, just mimic it. Like, for real. Because if you don't know, you don't know. So just mimic what they're saying, of course, if it makes sense. Right? But observe how other people are talking to their patients and talking to family members that have questions about stuff. Observe it and clock it and, take notes. Because, again, we might not always have that skill set in place, and that's okay. That's okay. And if you don't know, ask for help. This goes back to my other point. Patient asks you something, I don't know. Let me find out. Let me ask around. I'll get back with you. Give me a moment. I'm gonna see you. Let me talk to my charge nurse. Let me find out. And again, going to the whole charge nurse thing. We didn't have that in nursing homes. We were the charge nurse. Let me talk to myself for a minute. Let me confer with with self, and I'll come back to you with an answer. So we have these resources. We have respiratory therapy. It was times where you were given the breathing treatment. You had to remember to come back. You're like, oh, child, I forgot to take the dang on mask off of her. Let me take this mask off this lady. You giving your own breathing treatments, your own medications, your tube feedings. You got trach patients. You got patients that's trying to get on the floor and fall. You have all these wounds you have to take care of. We got wound nurses in the hospital. There's way more hands on deck in the hospital. So take advantage of that. Please take advantage of it. Please. And watch what they're doing. Watch how they're doing, because they might do it differently. Yeah, you've probably seen a wound vac get put on numerous times in a nursing home. A lot of hospital nurses, they couldn't even touch a wound vac. They have no idea how to do it. We do them in the nursing homes a lot. That's how I learned how to do it, was in nursing homes. But they might have a different technique. It might be a different way to do it nowadays. Watch what they're doing. The way they might explain it to the patient may be different. You want to learn that verbiage. You want to learn how to communicate as best as you can to your patients, because they're going to remember it for a lot of them, right? Whereas the nursing home, it's just like, okay, Miss Johnson, please take this pill. Please, just take your medicine. Just take it. She not asking no questions for real, or she may or may not remember. But those patients, they're going to remember in the hospital. Now, let me also tell you this. If you are coming from long-term care and working in the hospital, don't be scared. Don't be scared. Like, do not be afraid, because a lot of your patients in that nursing home, guess where they going? To the hospital when they get sick. So you're going to see Granny and Pawpaw at that nursing home acting a fool. Or they're going to be so cute, Look cute Granny with her UTI. Okay. She frightened you, but you got to give her that dang on, what they get for the UTI. What they be getting? Rosefin? Child, Zosyn, Cefepime. Like, they be getting, they getting whatever they get. So they getting what they get, and you got to give it to Granny. A lot of your patients, they're going to be in the hospitals. So don't be too afraid of that patient demographic, because a lot of them are going to be 70, 80 plus. You're going to be taking care of geriatric patients irregardless. So just know that there's plenty of skills that you have coming out of long-term care that you are going to be able to transfer to that hospital setting. So on one end, don't feel like, oh, I've been doing this for so long, I don't want to humble myself and be a new nurse to a certain extent, because it's a new specialty and it's a new acuity of care. That's one end. But also on the flip side, you have to realize that your experience in that nursing home makes you a very strong nurse in the hospital. Taking care of 30, 40 plus patients, and now you taking care of 5 or 6. Oh yeah, you understand time management. Oh, you do. You really do. You understand time management. You understand prioritizing care. Now it's just a matter of you honing in on it, sharpening that up, learning those additional skills that you need to learning those additional terminology, beefing up your communication skills, beefing up your patient education skills. Now this is the time for that. But you have skills that you are able to translate into working in a hospital setting. If you worked in long-term care, you do. So don't become intimidated by it, because you still are a nurse. A nurse is a nurse, okay? You're just in a different setting, in a different specialty. So do not get too much in your head to the point where you feel like you're not good enough for it, okay? Because you're still a nurse, babe. You're still a nurse. The charting might be different. The terminology is different. The patients are different. The diseases, the different things that they have are different, yes, but you are still a nurse. Okay, you are trainable. Everything is teachable. I remember somebody, a guy named Carl that I've done a few videos with. I remember he told me, he said, that's teachable. Everything's teachable. He said, you can learn that. I can teach you that. That's not, because I was getting like kind of flustered about something. He said, that's teachable. Like, what are you talking about? So if it's something that you can learn, don't allow yourself to get too much in your head about it. Okay. Don't be too in your ego, and also don't be too, timid, or I don't want to say it's timid, but don't allow yourself to cut yourself short, right? Don't cut yourself short, because you have skills that are translating to you working in that hospital setting. Just got to, hone in on them and sharpen them, and they're going to come back to you. All of it's going to come back to you. It really, when they say all of it, it does come back. And if there's something you need to look up, a terminology you don't know, a procedure you do not know, a medication you don't know, look it up. We're learning, man. Like, we're lifelong learners in this nursing game. So allow yourself to be that. But also talk your stuff. Flex your flex. You are a nurse. Let me see. Is there anything else I want to tell you all? I don't know if this is a tip or whatever, but I will say this. Protect your energy. Of course, you need to do it in nursing home. You need to do anything in healthcare. You have to protect your energy, but sometimes in the hospitals, you're seeing death more often. We do see it in long-term care, but it's expected, right? It's expected. They're older, whatever. They've been here for the past 12 years. They're 80-some years old. You know it's going to happen for the most part. But sometimes in the hospital, some things are sudden. You know, oh, I just had this patient yesterday. Now I come in and find out they had a cold. My patient passed away. These things happen. Or they pass away on your shift and it was nothing like you couldn't bring them back, whatever. It does happen. It really does. So protect your energy with that. But also with your coworkers, things can be a little bit more catty. I don't want to say they're more catty in the hospital compared to the nursing home because it goes down. It goes down in a nursing home. It goes down. Okay. In the nursing homes. But anywhere in healthcare, you need to learn to protect your energy. Meaning, I had a patient that was so moody. I mean, one minute the patient, oh, you're beautiful. Oh gosh, you're so kind, you're so sweet, you're so nice to me. To what the F is your problem? You people, you asshole, going clean off. I mean, to the point like, okay, you're not gonna talk to me that way. I'm leaving. Walk out the room because it's only so much you can take, right? It's only so much you can take. And it was a point where I had to just be in his room and he was talking foul, talking crazy because he was in his mood. And I had to just continue doing what I had to do. Swallow it and not even take it personal. Don't take the good when they praise you. Don't take it personal. And when they talk crazy to you, don't take it personal because it can change. 1 minute in your face, you're the best nurse ever. Then the next shift comes in. Oh, you know that nurse? I don't think she knew. I don't know if she. And then you come back in. Oh, I'm so glad you're back. Right? People are crazy. So even your coworkers, man, like, don't take any of this stuff personal. And I feel like in nursing homes, it feels more like a home, right? It feels more like a family, if you will. I know that's so cheesy. And it could be the nursing home that I came from because I was working there forever. I started off as an NAT, became a CNA, became an LPN, and then became an RN. I wasn't an RN at that nursing home, but I came back and worked a few shifts as an RN. And so they saw me, right? Everybody there saw me grow into the nurse that I am today. So it felt more communal versus in the hospital, then the streets. That's the streets. That's the ghetto. So, I mean, really the nursing homes is the ghetto. All of it is ghetto. Life itself is pretty ghetto. But in the hospitals, I really work on protecting my energy because it's a lot of people. It's a lot going on. And I try not to be too much into telling my business and being friendly with people because it just, even the doctors gossip, okay? There's too much going on in them hospitals. So in healthcare in general. So keep yourself to yourself, okay? Protect your energy. And when it comes to the patients, do the best you can. That's all that we can do. All that we can do is the best that we can. We ask for help. And when you get into those positions where it's a lot, it's overwhelming, it's too much, you need to pray or you need to affirm. You need to say, you know what? I'm grateful that I've been given the strength, the compassion, and the patience to take care of my patients and get them the best care that I can. Thank you for looking over me, looking over my patients, looking over my coworkers, looking over this entire facility and getting us through this night, getting us through this day. I'm grateful that I'm able to take care of people. Whatever you got to say, affirm, pray, but protect your energy because they will suck you dry, okay? Down to the bone. And no one is going to come and save you. No one cares. I care, you know? I care enough to do this video for you, but honestly, no one cares. So you have to care about yourself. You have to take your break. You have to go to the restroom and drink your fluids and get your steps in and move around and keep a positive energy. Keep a positive energy because I feel like you create the vibe. Just like how could be one person on the floor that acts a fool and they're constantly negative and constantly talking about this and that, and they drag it down. You could be the person that come on the floor and you're chill, Bill. You're chill. You take everything. Hey, whatever. Let it roll off your back. I'm here. You got me for 12 hours, babe. That's my mindset. You have me for 12 hours. I'm here for 12 hours. So whatever got to happen, got to happen. Now, I might be frustrated. I might not want to do it. I might be tired, exhausted, all of these things. But at the end of the day, I had to bring myself back to that grounded energy of I get to clock out. And again, my husband has told me that before. He's like, girl, you get to go home. I don't know why you be getting all mad. You get to clock out and go home. They got to stay there. Talk about the patients. I'm like, you know what? You're right. He said it a long time ago. So instead of the patient going off on me, I could have went and walked around to everybody on the floor and told me, he talk like this, he talk like that. That man is crazy. Nope. I just walked away, gave myself a moment, and I was like, I'm not gonna. I could say some crazy stuff to this patient right back, right? But why would I? What is that gonna do for me? All that's gonna do is make the patient act even more irate and make my night even harder. And then I go back in the room, the patient's like, oh, you're so sweet. Oh, thank you so much. Oh gosh, you're so good to me. You're the best. Right? I've created this whole thing, brought up my cortisol, so mad, went off, stepped out of my character to go off on the patient, and the patient they completely unbothered by it. But they living rent free in my head. If anything, I'm paying them a stipend to live in my head. So again, don't just protect your energy, babe. Protect your energy. Okay, you are the prize. Let me say, look at me. You the prize. But honestly, like, we are blessed to take care of people. We are blessed. We are in a position to take care of it. Do you understand how much abundance you have that you can take care of yourself and another human being? That's abundance. You have enough reserve for you and others. That's already put you in the mindset, in the actual frequency of abundance. Think about it. Think about it. Similar to being pregnant. You can sustain your body, all of your organs, and now you're creating and sustaining another human being's organs on top of that. Sometimes it be 2, 3, 4 kids in there. And your body is able to do that. That's abundance. So see what you do as a blessing. See what you do as a calling. See what you do as something that, like I said, it really is a blessing to care for other people. And I've said this before in other videos. It's like one of the most human things you can do is to be of service to others. The most human thing you can do is to help people. Okay? And I'm grateful to be able to help people because people need help. Like today, I was leaving my job and I already clocked out, child. And there was a Spanish speaking patient, not patient, but a family member. And it was like 5 of us trying to figure out what she needed to get. And she said something. I was like, oh, emergency. Like she parked by the emergency room. After I was thinking that she might have parked by the emergency room. But I was like, emergency? She's just like, see. I was like, okay. So I took her to where the emergency is. And when we finally got her, she's like, oh, yes, see. Gracias. I was like, okay. I was like, they're not. Okay, like, okay. I found her. But at one point, I could see she probably was getting anxious. She probably felt like, dang, like, it's like 6, 7 people around me and nobody knows what the hell I'm saying, you know? But I was like, okay, girl, let me walk you over here. Got on the elevator, to walked her down, and she was good. Okay, I could walk away feeling good. Could have easily walked right past that lady and went to my car and kept it pushing. But in my heart, not to say, oh, I'm such an amazing person, but I think it's a blessing to help people. It really is. Like, if a person needs help, like, they need help. I don't know, I'm just saying it over and over again, but if a person is to the point where they have to ask for help, like, that's something, you know? Now, I know some people, they always asking for help. They always got their hand out, but in that moment, that woman, there was no Spanish signs. And I'm looking like, we really don't have any Spanish signs around here. We need some Spanish signage, like at least on the elevator, or like our little signs that show where stuff is, like the directions. Like we need to have some Spanish in here. Like this is, as I'm looking, I'm like, oh, we need that, you know? And that told me, girl, learn some Spanish, child. Learn you some more Spanish. You work in healthcare. Get it together. So let me know y'all got some tips on that. But I love you all. I appreciate you all for watching, listening in. Hopefully you're going for a walk or getting your steps in, working out, you know, whatever. Driving your car, whatever, taking a little break, listening to these videos. And let me know what you resonated with. What did you connect with? Are you in a nursing home right now? Do you want to work in health? Do you want to work in the hospital setting? Are you nervous about working in a hospital setting? Or are you just pumped up and ready to get it going? Have you transitioned already from nursing homes to the hospital? How has it been? Let us know in the comments. Let us all converse. Okay? That's how we all learn and get all the tea. So again, I love and appreciate you all. And man, I'm so grateful to be in the hospital because them nursing homes, whew, they're not where it's at. They really are not where it's at. So yeah, I'm glad I'm in that hospital because it's way less craziness. It's craziness. And granted, you still gonna be huffing and puffing with 6 patients. I think I still didn't have a lot of time to myself with 6 patients because even though I was done taking care of my people at some point, I had another nurse that she had like 3 admissions. So I was like, let me help her. And that's another thing, you all. This is just a side note. Help your teammates. Help them. And also keep in mind the PCT may not do as much as you think that they're going to do. And a lot of times they're doing way more than you think that they're doing because they got a lot of patients to take care of too. So help them out too. They're all our patients. Take them to the bathroom, clean up the bed, take out the trash, do all the things. They're all our patients. And if you do well by your PCTs and by your patients, they're going to do well by you. Okay. Now it's some people that you help them out and they see it as, okay, I can sit back and do nothing. Honestly. Then you have the text that they appreciate it. And either way, it does not matter because you're there to take care of the patient. So as long as the care is being done, it doesn't matter who does it. But of course, you don't want to do anyone else's job completely. But hey, this is still your patient. The room is dirty. It stinks. And you do that. Clean the room. Take out the trash. Okay. What did that take you? 2 minutes? But because you think the tech's supposed to do it, you don't do it? No. These are your patients. When you do change a shift and the next shift come in, they don't think, oh, why didn't the patient care take? They looking like, why y'all left this room so nasty? I remember somebody like, oh, I took her to the bathroom. I go in the bathroom. There's pee everywhere. The hat is just full of urine and there's just pee. I'm like, y'all can't just dump this out, rinse out the urinal, wipe off the commode. Like, come on, y'all. You just leave 600 mLs of pee just sitting in here chilling. Like, why? Why? They change the patient and it's just poopy wipes just sitting all outside the dang on trash can. Like, why, y'all? Now, granted, I know the tech can go and do it and the nurse may have never even noticed it, right? Like, honestly, especially on day shift because it gets crazy. It gets crazy on all the shifts. But at the end of the day, these are your patients. And the way you end it is the way they started. Okay, so the way you end it, you want to try to end your shift on the best note so they can start on the best note. And also so it shows that you did what you had to do. Because you could be perfect nurse all night. But if that room look a hot mess, if that bed is full of urine, it looks like you did nothing all day. But y'all know this. I'm going to stop talking because it's time for me to go to bed. It's 9 o'clock in the morning. And I just worked a 12-hour shift. So I should go to sleep, shouldn't I? And I took a melatonin. So I'm going to let y'all go. I love y'all. So much peace, energy, happiness, good vibes. Know that what you do is important and that you are needed. You are appreciated. Okay? I love you all.